It was Fever in the Funk House on Capitol Hill. First up, Health and Human Services Secretary Robert Kennedy Jr. Boy, Congresswoman Coleman Watson laid into his ass when it comes to his agency. Roll it.
Mr. Secretary, few things enrage me more than the racist attacks I see this administration carrying out by embarking on an ignorant crusade to rid the government of any programs that are working to improve the lives of Black Americans. The administration has moved to ban the words Black, race, bias, minority, oppression, prejudice, discrimination, disparity, and racism. Any grant application on federal programs that include these words had them immediately stripped. It is painfully clear to me that in doing this administration that you work with and work for is attempting to legitimize racial discrimination, and that, sir, is a moral disgrace. It is not woke to improve the health and well-being of Black people who are disparingly impacted by just about every health issue. It should not be controversial to make right a healthcare system that was not built to help people like me, to take my concerns, my pain, my health very seriously in this country. Black women die from childbirth, complications at a higher rate in this country than any other high-income country. And last year, where there was overall maternal deaths dropping in this country, well, Black women maternal deaths rose. This sickens me, and it tells me that our government has so much more that we must do to focus on improving the lives of Black women, not less. Your decision and justifications are damning and troubling, particularly for destructive impacts your choices and benefits will have on poor minority people. So tell me, sir, how will eliminating minority health offices, how will eliminating initiatives and programs across the department that were created to look at the disparity in healthcare and the need to give greater attention to the fact that Black folks' experience in healthcare was very damaging, was very different? How exactly will HHS banning the words that we use to describe ourselves make us healthier?
Congressman, President Trump's vision of this country is the same as Martin Luther King's, that we should have a colorblind administration. President Trump is deeply concerned about the maternal health crisis and the fact that Black mothers are more likely to die in childbirth 2.6 times, 260%.
So
more likely to die.
Excuse me, sir, let me claim my time because I don't need this rhetoric about Donald Trump and the lie that he cares about me and Black people. What I want to know is the proposals. I'm claiming my time, sir, reclaiming it. I want to know specifically, how do you intend to address those disparities and to overcome those disparities as it relates to Black health in this country with the changes that you've decided are important, or someone has decided for you, I don't know, with your department? Specifically, sir.
I've spent a lifetime working on those priorities, and I continue to do so. We have 8 divisions, 8 programs for minority health at HHS. We've closed one of those offices. We're maintaining the other 7. We have 42 programs for maternal health. We're going to close a couple of them and consolidate them. We're going to still spend $1.7 billion a year. The commitment is there. We're just reorganizing.
Okay, you know what? And the impact of reorganization is something that I shall continually ask you to show me. So please let me warn you now.
I welcome those inquiries.
And I don't want rhetoric. I want numbers. The other thing that really troubles me, sir, is LIHEAP. It is a program specifically to address the needs of low-income and minority families as it relates to heating and even air conditioning. Why And what is your rationale for eliminating that program specifically? Why?
I'm very
What?
committed to LIHEAP. My brother ran a low.
I don't care about your past. I care about your functioning in this department, in this administration right now in response to this question.
My time has expired.
Oh, well, then so has your legitimacy. I yield back.
Well, now, my panel, Rebecca Carruthers, Executive Vice President, Fair Election Center out of D.C., Niambi Carter, author and associate professor, School of Public Policy, University of Maryland. Also, Andrew Clark, managing partner, District Legal Group out of D.C. Glad to have all three of you here. It was a little fired up there, Rebecca. A little fired up there. Okay, let me know when we get Rebecca back. Niambi, I'll go to you. That's what happens when this called light his ass up.
Well, listen, I think this is a problem that so many of us have with this administration. Look, Bonnie Coleman has been around for a very long time. She is not a dumb woman and not to be trifled with. And unfortunately, we don't see a lot of fire in the belly like we see from her. And I think that's why it's so exciting to see, because this is the kind of congressional oversight we need. It has been clear that in this particular administration that people's credentials and bona fides do not matter. And Kennedy was trying to give a lot of talking points, even invoking Martin Luther King, who, quite frankly, if they had their way, we wouldn't even be able to talk about him, his name, or his politics. They want to misrepresent their record. And the fact of the matter is these people don't care about Black people, and they certainly don't care about Black women. And so this whole talking point of what we're trying to do is reorganize, is consolidate. We want to make healthcare delivery better for Black women is hogwash. We know they're doing everything they can to undermine the social supports and the social welfare network that could support many Black families, Black mothers, particularly those who are low income. And everything from firing federal workers, where we know a lot of Black women are employed or were employed before this administration, down to Medicaid and Medicare expansion. These people don't care about Black people. And I think what Congresswoman Coleman did show was that these people are just about the talk. The only thing they care about doing is destroying and lying, quite frankly. And, you have to think about what our grandmothers told us. If you lie, you cheat. If you cheat, you steal. And if you steal, you kill. And these are politics of death these people are dealing in. We won't even be testing our milk pretty soon. This should concern all of us. And I think she cut to the quick with this one today.
Rebecca, listen, this is what needs to happen, how they must be challenged.
Yeah, absolutely. Because here's the bottom line. If this administration cared about the health and well-being of Black people, then they would do what it takes to increase the number of Black healthcare workers, specifically Black doctors in this country. Today, they would not have went after and decided to investigate some scholarships in Ohio that looks to diversify the medical industry. If this administration really cared about the health and well-being of Black folks, then the president would not have the executive order that looks to change some of the accreditation policies for medical schools, which includes having demographics around diversity to make sure that there's a diversified pipeline of people of color that's entering into the medical profession. So, hats off to the Congresswoman for using her voice and being forceful. And this is the type of thing that we need in order to challenge this administration.
Yeah, because at the end of the day, these thugs are going to do exactly what they're going to do. And Andrew, they must be pushed, prodded, and called out and challenged at every turn.
And first off, we're talking about healthcare here. Can we just address the elephant in the room? What is going on with my man's voice? Why does he sound so raspy? And he's supposed to be the head of the health for the whole entire United States. Somebody get him a cup of tea. Somebody get him a lunch or something, because the boy just don't sound right. Now, I'm not going to pretend to know what to do with women's rights, because then I'm just going to be just like him. I'll leave that to my esteemed panelists. But one thing that I hate when they say, when they talk about equality, and they try to bring up Martin Luther King. Martin Luther King lived in a time when there was no equality, and he was trying to at least get us up on the same pedestal. And what we're talking about here today is discrimination to try to knock us down off the pedestal to which we're sitting. So please stop using MLK's name, and also please somebody get that man a cough drop or something.
No. Somebody get him a new job.
Hello, I'm Isaac Hayes III, founder and CEO of Fanbase. Listen to what I'm about to tell you. The window to invest in Fanbase is closing. We've raised over $10.6 million of our $17 million goal. That means there's room for less than 6,370 people to invest in Fanbase for the average amount. The minimum to invest in Fanbase right now is $399. That makes you an owner in Fanbase today. Go to startengine.com/fanbase to invest. Why? Because current social apps have taken advantage of users for far too long, with content suppression, shadow banning, harmful racist content, and no real tools for monetization and equity. Fanbase has over 1.4 million users and counting, allowing anyone to reach all their following and monetize their content from day one. Social media is the new TV, and whoever owns the apps that distribute that content have the opportunity to own potential billion-dollar companies. While big platforms with uncertain futures are failing to serve their users, Fanbase is stepping up to fill the gap. Don't wait until it's too late. Invest now, invest for yourself and your future. Go to startengine.com/fanbase and own the next generation of social media.